Professor Piot, dear Peter, dear Professor Brusafero, ladies and gentlemen. When we're talking about the pandemic, it is usually hard to find good news. But when we look at science, the picture is completely different. If there has been one bright spot in this crisis, it was the unprecedented level of scientific collaboration. This international collaboration has enabled fantastic breakthroughs. Of course, I'm first and foremost thinking of the development and authorization of vaccines in record time. You know that what normally takes 5 to 10 years, scientists made possible in less than 1 year. Today, I want to discuss with you how we can strengthen this cooperation even further. Because the next pandemic must not find us unprepared. Health is a global public good. It must be accessible to all people in all countries. And this is why the Italian G20 presidency and the European Commission decided to host a global health summit on May 21st in Rome. Together, we want to agree on a Rome Declaration of principles. Such principles can be a powerful guide to prevent future crises and to be more resilient in the face of future global health threats. Because even if this current crisis is not over yet, we need to take a long-term view, already now. And this is why I want this declaration to be embedded in sound scientific evidence and real-world experience. And for this, we need experts like you, who are dealing with global health challenges on a daily basis. And therefore, I'm really grateful to all of you for making it possible to participate in this panel already for the second time. I'm particularly pleased that we have experts from so many different countries with us, because each country has had its own experience during this crisis. And I'm sure that this panel will draw from these experiences. There are many important questions to be discussed. What scientific and public health action is needed to prepare for future health threats? How can we better involve research groups from low and middle income countries? How can we overcome the lack of diagnostics and the shortcomings in the management of test data? And importantly, how can we avoid that science is politicized, often with poor outcomes as consequence? The world is waiting for answers. In the European Union, we have already started to act. With our HERA incubator, we want to get ahead of the curve in the next phase of the virus. For example, we're boosting our production capacity in Europe. Production capacity for Europe, but also for the rest of the world. Just as we're doing right now with vaccines that are being delivered to Europe and vaccines exported around the world. We are accelerating the development of vaccines. And we are stepping up research and data exchange between science and industry, because in times of crisis, time is of the essence. And last but not least, our ambition must be to achieve the same level of preparedness at a global level, especially in the low and middle income countries and for the most vulnerable. And this is why we need your input, your ideas, your expertise, and your passion. I'm very much looking forward to our discussions. And I thank you for giving us your precious time and expertise. Thanks a lot.